come true. I make them.
Hello everybody, my name is Dragonborn and this is Surgeon Squad. Well, welcome back. And I don't know why I keep doing that, you know. So, well, hi everybody, welcome to this. Well, actually, welcome back. I don't know why. So, welcome back to Surgeon, similar to kind of like thing. And this is actually like removing tattoos. So, we've expanded from being a dentist, a surgeon, and now we.
Welcome to Surgery Squad's laser tattoo removal. I'm Dr. Susie, and I'll be assisting you with this procedure today.
That is loud.
According to a recent poll, over 50% of those with tattoos want at least one removed. They cited being too young when they got it, a new career, or significant life changes, such as divorce or childbirth, as reasons why they no longer want them. Luckily, there's laser tattoo removal. Laser tattoo removal is a procedure that uses a powerful laser that reacts with the ink of a tattoo to break it down into tiny particles. The laser directly targets the tattoo pigment and leaves the surrounding skin virtually untouched. After the ink is broken down, it is removed by the body's immune system, creating a natural-looking fade that typically only time or sun exposure would produce. Although laser tattoo removal is considered highly effective after multiple treatments, those interested need to keep in mind that yellow, green, and fluorescent tattoo inks are much more difficult to fade. Our patient today is a male in his mid-20s that got a tattoo on his calf when he was a teenager. Now that he's older, he doesn't see the tattoo as being so attractive anymore. In fact, he's come to us to get it removed. So let's scrub in and see what we can do for him.
Remember this guy?
Before we begin, we need to go back in time to the day he picked out his tattoo. Help him pick out a real winner. Use the arrows to scroll through the tattoos. Click Choose when you have made up your mind.
Princess Beth. Type sexy. Oh my god. So there's rolling dice. There's that. There's Spring Break 99. A lizard. Princess Beth. I'll type your text here. So it. We'll go for this one, shall we? And it's easy as that.
Yikes! She doesn't really look like that, does she? Let's make that tattoo disappear. During our patient's initial consultation, it was recommended that he take a non-aspirin pain medication prior to the procedure to reduce any discomfort he may experience.
Cool.
Other than that, there really isn't any other preparation needed. So let's get started. A lot of patients describe the pain from the laser as feeling like 100 rubber bands striking the skin at the same time. So to begin the procedure, we'll need to place a cold compress on the tattoo for a few seconds. This will help reduce the pain caused by the laser. Go ahead and place the cold compress on the tattoo.
Oh, quite cold. Is that a bag of
That
peas?
will do.
Or a fish?
Now we need to use the laser to fade the tattoo. Different types of lasers react with certain colors of tattoo ink. One laser might work perfectly for reds and oranges, but not so great on greens or black. So we'll use a variety of lasers to get the desired result. To help relieve some of the pain associated with the procedure, we'll also use a machine that blows icy cold air on the area being treated. Let's start by targeting any red or orange ink areas.
Oh, I'm burning him alive. Oh, I'm burning him. Oh, I wasn't even paying attention. Oh, remove the red ink when done. Is everybody happy with that? I am. I wish I could write my name. Very funny.
Next up is green, blue, or other darker colors.
Green, blue. Green, blue. Oh. This is it. This is what I'm meant for. I need dark colours. That's it, innit?
Finally, we'll remove the black.
Like, to be truthful, that looks a lot better to me, in my opinion. But that's just me. Oh god. Oh, it looks evil. Look at that. That's how you're supposed to do it. Like a moose. Now what?
Now that we've completed the first treatment, we'll need to place the cold compress on the treatment area to relieve some.
Yeah, we know. The bag of peas.
You did great. Our patient is ready to go. Immediately after each treatment, the tattoo may feel sunburned, and it is extremely important to keep it covered until it heals. If our patient fails to do this, both his recovery and the results of the treatments may be negatively affected. Roll the bandage over the treated area.
I like the epic rip.
As stated earlier, our patient's tattoo will only begin to fade after multiple treatments, so he shouldn't expect the tattoo to go away during one session. While the tattoo may not be completely removed, it should be lighter and much less visible than before. And that's laser tattoo removal. Well done! Why not try your surgical skills in another surgery here on SurgerySquad.com?
Dental filling. Does anybody know if I've actually done dental filling? I'll be back. I need to make sure I haven't done dental filling. I don't think I have. 2 seconds. I'm back. I'm not sure if I've done it. So, oh god, sorry. I ain't gonna tell the difference. Like I was saying, I'm not sure if I have, so I'm just gonna go straight in and do it. So, hold on to your asses if you don't like dental stuff, because I don't. It goes through me.
Welcome to Surgery Squad's virtual dental filling placement. I'm Dr. Jeff,
Hi, Jeff.
and I'll be guiding you through this procedure today. Fillings are the most common and affordable dental restorative procedure for both children and adults. They're used to restore the function and integrity of missing tooth structure, commonly caused by tooth decay. By placing a filling, we reduce the amount of bacteria in a patient's mouth, extend the life of the tooth, and delay the need for additional dental work indefinitely. Our patient today has been experiencing some slight discomfort in their lower left first molar, or, as dental professionals might say, tooth 19. Before we begin, we need to get some x-rays taken of our patient's teeth. X-rays, or radiographs, are essential, low-cost diagnostic tools used to examine a tooth's roots, check the health of the bone surrounding the tooth, observe the status of developing teeth, and find abnormalities such as cavities. Let's get started. First, insert a positioner into the patient's mouth.
You learn a lot about surgery how they done, you know. But they always say, don't try it at home. Yeah, I'm gonna pin my little sister down and do surgery on her. Like Outlast all over again. All over again. Did that tongue just move? I don't know. Be right back. And I'm back. Let's kick some ass.
Next, position the x-ray cylinder where indicated.
Where indicated?
Great. With the x-ray cylinder in place, we need to get behind our radiation barrier to reduce the amount of radiation we're being exposed to, and take the picture. Don't worry, the lead apron will protect our patient from any unnecessary radiation exposure.
Why are you talking about?
I couldn't have done it better myself. I'll have my assistant handle the other x-rays, so let's move on.
Yeah, let's move on then.
With all of the x-rays completed, it's time to look for potential issues. When examining dental x-rays for cavities, look for hints of changes in the density of a tooth's enamel, or dentin. These locations will appear as darkened areas on an x-ray. This is because the decayed portion of the tooth is less intact, and the x-rays can penetrate that portion of the tooth. Do you think our patient has a cavity?
At this point, I would have actually ended the episode and said, what do you think? Write in the comments below, but nobody actually comes on my video, so... do you think our patient has a cavity? Yes!
I agree. Can you identify it on the x-ray? There it is. We need to get that taken care of as soon as possible. Let's get started. Now that you've identified the cavity, we need to apply a topical numbing gel to the anesthetic injection site to help reduce any discomfort the needle may cause.
Yes, we know, right. What we're saying, I forgot what I said now, so we're just going to carry on. Tongue's moving. Can I put it in the tongue? Oh, no, I can't put it in the tongue. Put it there then! Oh, God. Nasty.
Next, we can administer the local anesthetic. The patient will, at most, feel a slight pinch. Afterward, the area will become numb for hours, even though the procedure will only last a few minutes. Take the syringe and inject the local anesthetic into the patient's gums, just below the tooth we'll be working on. And now we'll give our patient a few minutes to become completely numb.
A few minutes. 5 minutes later. Love a drink. No, it's not beer. It's cold.
Now that our patient's mouth is numb, we can move on to removing the decay. To begin, we'll need to isolate the tooth using a cotton roll. This will give us some space to work.
I didn't know she's numb. You know, could try and punch her in the face, see if she feels it. If she feels it, then we need to put more needles in there, don't we? Oh.
Looks good to me.
It looks
Dentists
shite
typically
to me.
remove tooth decay with a burr inserted into a handpiece. This is what most people refer to as the drill. Prepare the area by using the burr to carefully remove all of the decay from our patient's tooth.
Hold on to your asses. Things are gonna get evil. Oh, it's a sound! Oh, why's it across?
Now that the decay has been removed, we need to figure out which type of filling our patient wants, amalgam or composite. Both have their advantages and disadvantages. Amalgam fillings are more durable than composite, but they don't have a tooth-colored appearance like composite fillings. They also often require a larger portion of the tooth to be prepared in order to retain the filling. Composite fillings are much more aesthetically pleasing and require less drilling than amalgam, but they can be a bit more expensive.
Well, which one? I mean, if you want the expensive one, in fact, no, I'm gonna spend the money.
Sounds good to me. For a composite filling, we need to apply a self-etching dental adhesive to the prepared area of the tooth. This creates a rough surface that helps the filling bond to the tooth.
Wicked. Oh, I'm glad there were no sound effects for that. Ooh.
Now, dry the area using the air syringe.
It's just a squirting.
Next, you'll need to apply the self-etching dental adhesive to the prepared area of the tooth one more time.
Oh yeah, I'm not downstairs this time. I'm actually upstairs, back in my room again. Forgot to mention.
Use the curing light to harden the self-etching adhesive.
Clear!
Nice job. Let's get a filling in there. Take
Yeah,
the
let's get a
composite
filling.
filling syringe and place it into the prepared portion of the tooth.
Don't be a squirter. I'll thank God for that.
Pack the composite into the prepared area of the tooth using a condenser.
A condenser. We're using very posh words, aren't we? Oh! Oh, the scraping! The scraping!
Next, you'll need to smooth the filling using an instrument called a burnisher.
A burnish? Don't scrape. Oh! Oh! This is horror. You wanna know what horror is, people? This is horror. Oh, that's
Great. Place the
Hold on.
curing light over the tooth and activate it to harden the material.
Clear! Bank.
Polish the filling using the polishing instrument.
Oh, this sounds so bad.
At this point,
Oh,
the
look at
dentist
that.
checks the patient's bite to ensure that everything was normal and the patient doesn't experience any discomfort.
Well, that face says she's not.
Fortunately for our patient, you did an amazing job,
Oh,
and there doesn't appear to be any issues with the filling or our patient's bite. All done. It looks perfect.
Start celebrating.
After the
Look
procedure,
at that
our patient may
beautiful
experience some sensitivity, but it should subside within 1 to 2 weeks. If it doesn't, they'll need to contact their local dentist office. There is also the possibility that the patient's bite may feel a little off, since being numb can alter their ability to bite normally.
It does.
Once the patient regains feeling in their mouth, it is advised that they return for an adjustment if it feels like their bite is not
A
normal.
few spanners.
In effort to prevent future cavities, our patient will not only need to regularly floss and brush their teeth, but they'll need to ensure that they return to the dentist to have their teeth cleaned at least once every 6 months.
Once every 6 months.
It is also recommended that smoking is avoided since it significantly contributes to the development of tooth decay. And that's a dental filling. You've done a wonderful job. You may want to go back and try out the other type of filling, or why not try your skills in another surgery on surgerysquad.com.
Alright, Jesus freaking Christ, mother of God. Sick and tired of his voice. When at first you're like, yay, it's Jeff. Now it gets boring. There's no nothing to it. I'm not doing a video in a long while, so I thought I'd just do this because I've got nothing to do. So, thank you all for watching. Click the notifications for what I've done. As always, I actually thought I'd still left it on pause then. It's not still good. So, thank you all for watching. Click the notifications for what I've done. And as always, I will see all of you people in the next episode. I don't know what I'm doing next, so bye bye. Subscribe for more, and hit the like button for more, and share with your friends on Twitter and Facebook, and comment if you like the new outro. Every little helps. This song just makes me so happy. Everything is awesome when you're part of a team.